our school newsletter. So with that being said, we'll go ahead and get started. So on the agenda, we only have one announcement. We're going to hear from our EPI team about our respiratory updates, as well as hear about rabies. Our folks over at Oral Health are going to be talking about the amazing sealant program. As I don't know if you are all aware, but October is something has something to do with the dental health. And then we're going to hear from our vaccine equity program about health advocacy. Um, so we only have one announcement. As you all know, we have our newsletter monthly. Uh, we always recommend that you can click on the link to subscribe. But with that being said, we're going to go ahead and move it to our epidemiology team. Jake, are you on the call?
Hello, good afternoon. Yeah, I'm here. Can you hear me?
Yes, we can hear you.
Perfect. So thanks everyone for joining. I will be presenting on our respiratory updates for this month. So quick rundown is we'll go through COVID-19, flu, and RSV, as well as some other common communicable diseases that you'll find in a school setting. And then Andrea Manel, another one of our EPIs, will talk to you about rabies. Next slide, please. So here we have our RSV seasonal report. As you can see, we are currently in week 37 of the RSV 2024 RSV flu season. The flu season actually just started. Um, we're actually in the first week of it. That's week 37 of the 2023 to 2024 calendar year. Currently, we have more confirmed cases of RSV than normal. We have had 1,470, which is 91% more than normal. Individuals who are in the 15 to 64-year-old age bracket are currently having the highest rates of RSV, as 32% of all RSV cases are in this age group. However, children 1 to 4-year-old are the second most affected age group. As you can see right now, we don't have a ton of cases, but as we're leading into the fall and then winter months, and as school is back in session, we would expect to see some of these cases increase in count. Next slide, please. Similarly, here we have our flu data. In the current flu season, there were 4,993 confirmed cases, which is 89% more than usual. One thing that you do have to take into consideration is that case counts that we have now will all look to be above average because the COVID years tended to skew a lot of our non-COVID respiratory disease rates down. So just something to keep in mind. And like RSV, as we are going into a new respiratory season, we would expect to see cases increase. So make sure everyone is washing their hands and covering their mouths if they're coughing or sneezing as much as possible. Last week, there were only 6 cases, which is 33 less than the week prior. And as you can see, our case counts for the last few weeks have been about the 5-year average. We wouldn't expect to actually see a big spike until more towards the winter months. But we are starting to lead into that, so something to be aware of. Next slide, please. And finally, we have our COVID update. The line that you see on this figure is the 3-year average, which shows the average cases by MMWR week from 2021 to 2023. In 2023, we had 31,645 cases of COVID, and in 2024, Pima County had 13,000, which is 80% less than normal. Again, something to keep into consideration is that we did have huge spikes towards the beginning of the pandemic. So until we're a few years removed, these numbers won't really start to settle. Last week, we had a total of 383 cases as well, which is 11% less than the week prior. And as you can actually see from the case counts, while we did increase from the summer months moving into the fall, we haven't had a huge spike yet. And normally what we would expect to see is decently sized spike around Thanksgiving, followed by a much larger one around the holidays. So once again, something to just keep in mind as we move into respiratory season. Next slide, please. And then here we have all of our respiratory virus cases just plotted together, just so you can see what the case counts look like in relation to each other. So as you can see, over the last few weeks, we've had relatively few flu and RSV cases, with COVID having quite a few more, but not any sort of major spike, which has been good. Also on the bottom of this slide, you see a link to the Pima County Respiratory Illness Data website. That will have weekly updates with all of these figures, and it gets updated every Wednesday. So if you're, needing to find the most up-to-date information possible, you can find it at that link. Next slide, please. And then just a brief reminder for communicable disease reporting. You can see the disease reporting summary for schools at the link, the azdhs.gov/school reporting link. It'll give information like who needs to report, what's reportable, the turnaround time for what needs to be reported, etc. And then on the right, we have some common communicable diseases and some less common communicable diseases that show the turnaround time for how quickly you need to actually make a report. For most of them, it's going to be 24 hours after detecting a case, but some you can delay it somewhat. For outbreaks, you're going to want to report within 24 hours, regardless of what the outbreak is for, though. Next slide, please. One other note is that we have, I think this has been included on past slides, but just in case you weren't aware, the Pima County outbreak team has recently moved our outbreak reporting link. So if you wanted to report an outbreak, you could click on the link that is highlighted to the left over there. Next slide, please. Next, we're going to talk about just some common diseases that you find in a school setting. So first we have fifth disease. So fifth disease is a rash illness that's caused by parvovirus B19 or PB19. Some of the common symptoms can include fever, runny nose, headaches, swollen joints, and then the quote unquote slapped cheek rash. So it's a flush that appears around the cheeks and on the face. Uh, Fifth disease can be contagious before the appearance of the rash during the symptomatic phase, and it's important to refer to a healthcare provider for evaluation and diagnosis. But if you do see these symptoms, it would be something that's worth talking to a parent about. Any individual who is symptomatic should be excluded until they're fever-free for 24 hours without the use of fever-reducing medications, even if the rash is still present. Transmission is done from person to person with contact from secretions from the nose, mouth, and throat. And then the most effective ways to prevent transmission are, as almost always, going to be proper hand washing, covering coughs and sneezes, and staying home when sick. Again, it's person-to-person contact, so if you can cut out that transmission vector, essentially, you'll be able to prevent transmission from one individual to another. Next slide, please. And then next we have hand, foot, and mouth disease, which is a common outbreak that we experience in especially daycare centers. So symptoms include fever, sore throat, mouth sores that tend to blister, and then the stereotypical rash that appears on the hands and feet. This is also spread through person-to-person contact with body fluids or fluid from the blisters, as well as potentially from coughing and sneezing, and even just potentially talking to somebody, because talking can create aerosolized droplets. Hand washing and disinfection will be the best preventative measures. So if you do detect a case, make sure that you disinfect all the surfaces, all common contact surfaces, any toys that they might have encountered, sinks, desks, chairs, high contact areas would be the best approach. And then any child that is experiencing hand, foot, and mouth can return to school as long as they have no fever and they feel well enough to participate in class. Additionally, as long as they have no uncontrolled drooling with any mouth sores, because like I mentioned before, that'll be a very common way to have transmission from person to person. Next slide, please. And then, as usual, we have just some useful links for all of you. If you need some additional resources, we've got some stuff from PCHD as well as the Centers for Disease Control and the Arizona Department of Health Services. Uh, one more slide. And then if you need to contact Pima PCHD EPI, you can email us at epi@pima.gov. This is monitored regularly and is the quickest way to get into contact with the epidemiology department. You can also reach us by phone or fax, and the numbers are listed there. Does anyone have any questions for me? We're going to move on to Andrea's portion, which is the rabies, but prior to that, does anyone have any respiratory questions? Thank you very much, and I'll pass it on.
Hi, my name's Andrea, and the reason we're talking about rabies today is because we get probably a minimum of 20 calls a year from schools that have either live or dead bats on their school grounds, but rabies isn't limited to bats. Rabies still is a deadly disease. It is now to the point where it kills less than 10 people per year in the United States. But it's still around the world kills about 59,000 people a year. Next slide, please. So rabies is a virus that prevents the brain and spinal cord from working properly. Once symptoms begin, it is always fatal. It occurs only in mammals, and I mentioned bats, and bats are a mammal. They give live birth to their young, and they also have fur on them. And rabies is usually spread by saliva from a bite or a scratch. And at the health department, we conduct rabies risk assessments for people who may have encountered rabid animals of any kind. Next slide, please. Um, oh, okay, there we go. So these are animals with higher rabies risks. We have bats, coyotes, skunks, foxes, humans and pets. Pets should never die of rabies because they should all be properly vaccinated. And humans should never die of rabies either because there is post-exposure prophylaxis that can treat them if they've been exposed. Next slide, please. This is one of our typical graphs that we use. Shows the number of cases, the dotted line that we had in 2023, and the other ones are year to date for 2024. So as you can see, in 2023, the number of animal bite assessments that we did peaked in August. And this year it peaked in July. So a little bit about why we get high numbers in July and August, especially of bats, is that bats migrate through Tucson. They live here permanently throughout the year, but you've heard about the bats under the underpasses at Campbell and River and other places. So they like Tucson, but they also like to migrate to other areas. Next slide, please. So in Arizona, contact with rabbit bats is the common cause of rabies exposures. And in Pima County, we get the highest number of rabid bats in the state of Arizona in a year. Bat scratches or bites can be very small and difficult to see. So if you look at the red circle on this finger here, you can see a little red dot there, and there's another little red dot there. So it's really difficult to see. And so some people think, oh, a bat landed on me, but it didn't bite me. Well, it could have bitten you without noticing it. So a rabid bat might be acting strangely. They might be out during the day, which is odd because they're a nocturnal animal. They may have difficulty flying, or they may be found in a place you don't usually see them, like on the ground. Exposure often occurs when people pick up or handle a sick or dead bat. Most bats do not have rabies, but there's no way to tell without testing the bat's brain. So the best rule of thumb to follow is do not touch bats. Next slide, please. Also, rabies can also come from contact with wild animals like skunks, foxes, javelina, bobcats, and coyotes. In Pima County, skunks, foxes, and bats account for the most rabies exposures. If a wild animal approaches you, this is not a normal situation. So you should try to turn and walk the other way, or just try to avoid them. Don't try to get them to come closer to you. Domestic animals such as our pets and livestock can also carry rabies. Dogs, cats, ferrets, cows, and horses should get regular rabies vaccines. We did have coyotes earlier this year that attacked a couple of horses, and luckily they were already vaccinated, so they just got a booster vaccine. Pets should be kept away from wild animals to protect them from rabies exposure. And all bites to humans from pets or stray animals or wild animals should be reported. Next slide, please. So some common symptoms in either domestic or wild animals. It could be something like they're chasing their tail or they're trying to bite itself. They may become, this would be seen more in pets, in domestic animals. They may become fearful or start to hide from you. They may be staggering or have other difficulties walking, and they may show excessive drooling or foaming at the mouth. Another interesting is they might be biting or snapping at objects, either real or imaginary. Things we might see more in wild animals, or if it's a nocturnal animal, them being out during a day is suspicious. And for wild animals, they're normally going to avoid humans, but if they seem unafraid or aggressive, then turn the other way and go away from them. But one thing to keep in mind is that you can't automatically tell if an animal has rabies just by looking at it. Some sick animals might be acting strangely without having rabies. They should still be avoided. I had one case that I thought sounded like rabies by the way the family described the animal, and it turned out that it was distemper. So you can see other animals, but if you're seeing an animal doing that, call 911 or PAC or Arizona Game and Fish, depending on the type of animal. Next slide, please. So if you're exposed to rabies, since we're talking schools, I'm talking like children should report to an adult, like a teacher or a school nurse or a parent or a coach. Staff, if you find an animal, please report it to administration and they can contact the people that they need to. So one thing you should do is if you are bitten by any animal, you should wash the wound with soap and water for 10 minutes. You should call the Pima County Health Department at this number listed, 520-724-7797. That'll get you to the epidemiology division and we can complete a rabies risk assessment. School officials should call PAC at the number listed, 520-724-5900, extension 4, and PAC will come to pick up a bat. Or if you have another wild animal or an aggressive animal on your grounds, they will also come and pick up other things besides bats. Next slide, please. So in summary, keep in mind that rabies is a fatal disease that affects your brain and nervous system. It's spread through saliva, usually from a bite. It's spread from mammal to mammal, so bats, skunks, dogs, cats, um, foxes, and humans can be on the biting end of that generally. Animals may display symptoms of rabies like foaming at the mouth, staggering, or aggression. And you can limit your risk by avoiding contact with wild animals or unfamiliar stray domestic animals. If you do get bitten, please call Pima County Health Department for guidance on what to do next at the same number, the 520-724-7797. Also call PAC at this number to report a bite. Does anybody have any questions? I think I'm done then, and we can go on to, I believe it was oral health next.
Thank you so much. I appreciate it. So next we have oral health. Margaret, are you on the call? I think you're muted. Margaret, I think you're muted.
Yes. Yeah. Don't you wish you had a penny for every time you had to say that to somebody? Sorry. So I just wanted to say happy National Dental Hygiene Month. We are here to talk about the sealant program. I see many familiar names, some great supporters of our program, so you may already know some of this information, but we have room for more schools to participate. So we wanted to reach out and make sure that everybody is aware of the program and how easy it is to participate. So next slide, please. Cavity-free AZ, easy as 1, 2, 3. And we've really made great strides trying to make it very easy to participate. The schools that are eligible are schools that have 50% or greater enrolled in the free and reduced lunch program. That identifies the high need children, whether they have some insurance or no insurance at all, they're able to participate. So the program works is actually administered by ADHS, and they have been doing that since 1987. And it's been in Pima County that long, but about 2004, they kind of turned them over to local health agencies. Of course, in Pima County, it was Pima County Health Department. And so we now implement the school-based program in our local school districts. The school-based sealant program is one of 2 evidence-based programs to address community oral health. Community water fluoridation is the only other evidence-based program. So we're very excited to be part of that. We know the research shows this is one way to get to children that need dental care, whether it is a sealant or whether it is that we refer them for additional care because they haven't been seen recently or frequently. So ADHS gives us the list of the schools that qualify. We send out information and request the schools apply to participate. That gives us just some basic information, who the contact person is, how many students are enrolled in 2nd and 6th grade. We target 2nd and 6th graders because those are the years or the grades when the adult molars are coming in. And adult molars are meant to be there for their lifetime. So we want to prevent cavities in them and to hopefully extend the life of those molars. I tell the little 2nd graders, if you live to be 100 years old, and people do these days, those teeth have to last you 92 more years. So it's really important that we get them sealed. And the sealant is a plastic coating that seals the germs out. There's a lot of little nooks and crannies, cracks and crevices. We call them hills and valleys, but that's where the food and the bacteria get caught. And sometimes you can't even get the food or bacteria out, and they end up with cavities in those permanent molars. Yeah, I was going to say, hopefully we get to them, but unfortunately we see kids in second grade that those molars are already bombed out. That means there's not much left to them. The decay has just taken over their permanent molars. They might not even be looking at being able to save the tooth. But I'll talk a little bit more about that in a second. So once we get the application, we reach out and schedule an educational presentation. And we have some more details because we have a new program this year for the education. Uh, at that education session, at the end of it, we pass out the consent forms that go home with the children to the parents. And we wait a week or two for the consent forms to come back. It's always a struggle. I know I'm speaking to the choir there. You guys know how difficult it is to get things returned from parents. Um, and it really varies by school and by classroom. So we really think it has a lot to do with the culture of both the school and the classroom and the relationship the teachers have with those parents. Once we get the consents back, we schedule a date, and we have this lovely RV bought with bioterrorism dollars back in 2005. And we have Matt who drives us to the school, and the dental team gets set up. Matt goes around either to the classrooms or to the front office and pulls the kids that have provided a consent form from their parents. So we're really very self-sufficient once we get the school signed up. We need help finding the education dates, help establishing the clinic dates, but beyond that, we pretty much are off and running the day that we get there. Next slide, please. So what do we see during the screening? Well, the first thing that we see, yeah, there we go, is that happy smile. And I know you know too that this is what makes us happy to do what we do. We wish everybody looked that happy and smiling, all the kids. But unfortunately, we also see some of these other pictures there. Again, in second graders and in sixth graders, they have decay in the either in between the teeth or on the tops of the teeth. And then in some of the cases, we find abscesses in the kids. So that is infection. They don't always complain about pain. They may have forgotten that they had pain. And then once the abscess pops, the pain goes away until it comes back again. Last year, we identified, where's my numbers? Over 39 children with urgent dental needs. So again, think about that. That's pain or infection. And we know it makes it difficult for kids to eat, to sleep, let alone learn while they're dealing with that kind of an issue. And the recommendation is that they get in for treatment within 24 to 48 hours when they have pain and infection. And that's very difficult to do in our system. Unfortunately, we don't provide any emergency care, but we do provide resources to help those families get to emergency care. El Rio is one of our greatest partners. MHC is another one. And sometimes it's just a matter of letting the parents know that if they have access, that it does cover dental care for their child. It's amazing that some families still don't know that. And that may be because they know it doesn't cover dental care for adults or for themselves. But we work with the families to get them into care. We also obviously work with the health staff at the school. They get a list of the kids that we have identified that have pain, swelling, or infection. And sometimes their contact with the parent guardian is better because they're familiar with perhaps the family. We leave phone or we call and we leave messages, and sometimes we don't get return calls. Something about the government or the health department. I'm not exactly sure, but together with the health staff, we work to get those kids seen. Okay, next slide. We did want to tell you about our new education program. So this was developed with ADHS. The curriculum was developed by educators and some of us here. It's a presentation that's about 20 to 25 minutes, but they've developed the education so that it addresses some of the critical second and sixth grade Arizona English and language arts standards. It also addresses some of the Arizona health standards for second graders and for sixth graders. So it's not just here's your teeth and this is why it's important, but we try to help make it fit into the teacher's curriculum. We know that they're giving us time to educate the kids, and so we try to make it as appropriate as possible. The second graders, you might see that little coloring book. That book was developed for second graders to have them take it home. It's a short story that they can read to their parents. We all know how important reading is and how difficult it is to get that reading done every day, 20 minutes a day. But this very short story, the kids are excited about it. They take it home, they can color it, and we ask them to read it to their little brother or sister, or their big brother, or their mom, or their dad, or their nana, whoever it is. There's 3 simple questions in there, and it's all about dental sealants and the importance of taking care of their teeth. The sixth graders are a little more interesting, I think, personally, a little bit of a challenge sometimes. But we have an infographic that was developed for them. And we present that idea of an infographic, that there's pictures that can tell the story, there's verbiage that you can read, or a combination that will help you understand why sealants are so important. And then there's about 4 questions that they answer, sometimes in a group of 3 to 4, or sometimes individually. We have to be very flexible when we go to the classrooms, and we do whatever needs to be done there, however the teacher has us helping. Next slide, please. So this is a picture of our consent form. Actually, the front page, so it has parent information on them to let them know what sealants are, a picture of a tooth before and after, and then how they could get a hold of us if they wish. But part of the rest of the packet is actually the consent form or the permission slip. And the information and the consent forms come in English and Spanish, so the families have the option to fill either out. This year, we've gone with a digital online consent form as well. So we have a QR code that actually takes them to the web page, where they can then find the links to the consent forms that they fill out in DocuSign. You may be familiar with that. It's a software program. So the parents can fill it out on their tablet, their phone, their computer. They answer the questions. It looks just like, at the end, it looks just like our consent form, but they push a button, submit. It comes to my computer. We print them out and then have them ready for the school the day that we go to the school. It's not as popular as paper at this point, but we're making, I think, lots of headway. I think we've, out of maybe 400 consent forms, maybe 500, we have about 100 that have come in on the digital form. So we're trying to increase that. There's a lot of paper that gets wasted, unfortunately, but we're working diligently with DocuSign in our IT department to see how we can improve that. Next slide, please. So just the partnership. We really appreciate having the partnership with all the different school districts. We have over 151 schools that are eligible in Pima County. And we have had, let's see, 75 that have applied. 60, most of them have already been scheduled, either for the education or for the clinic itself. We have a couple of schools that we get 1 or 2 consents back. And again, we're targeting second and sixth graders. And then we have others that we've had 50. So it varies tremendously. And like I said, it really does seem to somewhat be related to that relationship and the culture that the school has. So we appreciate all the help we can get and support. This year we asked teachers and some principals do it, some front office staff to send home emails to parents to say, please check your backpack. Your child's bringing home a consent form. Friendly reminder, cavity-free AZ is going to be here next week. And some of those have helped a little bit too. But after all of these years, we really remain committed to trying to improve the access to care. We want to lower the risk of dental disease in our most vulnerable population, which are those cute kids and at the schools. And of course, we always support the use of fluoridated water, toothpaste with fluoride. There are fluoride treatments and dental sealants, as we mentioned. And we couldn't have done any of this without our collaborations with, again, the various school districts. Sunnyside and TUSD are our two largest school districts, and we have great turnout there. Flowing Wells and Amphi have several schools in their area, as well as Marana. Not all of them in those districts, but we are in the majority of them, and we'd like to be in everyone that qualifies to participate. So just once more, thank you again to all of you and the dedicated staff and our community health centers for helping us do what we do in cavity-free AZ sealant program. That's it for me. If you have any questions, let me know. We're always available with any kind of questions you have dentally related. We can find the answer for you. Thank you.
Thank you so much. So we're going to go ahead and move forward to our vaccine equity program. Betsy, are you on the call?
Yes. Hello, everyone. Can you hear me okay?
Yes, we can.
Awesome. All right. So I'm Betsy. I am the interim operations manager for the vaccine equity team. Our health educator was unable to attend this call, so I'm filling in today. So thank you for having me. Move on to the next slide, please. So we just wanted to talk to you all about the importance of self-advocacy, and especially starting this early when working with kids. And so some of the 3 key elements to self-advocacy is understanding your needs, knowing what kind of support might help, and communicating these needs with others. We know that advocacy is a process, and understanding how you can best advocate for your own health needs is something that's learned. And so if we can start early with youth and with kids, they can really start to understand how to talk to their doctors, how to talk to their parents, how to talk to other providers, counselors about the needs that they might have. And so giving them the skills and techniques to communicate those as well is super important. Next slide, please. So one of the key tenets I want to talk to you about as well is medical trauma. So medical trauma is the experience of emotional stress because of negative interactions with the medical system. And so some people might experience or have bad experiences at doctors' offices, which leads to this medical trauma, which actually leads to a decrease in access to care. And so health providers may refuse to take a patient seriously, and may speak over them or minimize what they're feeling. And so all of this leads to the patient feeling like they can't trust the system, they can't trust their doctor, they don't feel comfortable bringing up new or existing medical conditions. And so kids might experience this as well if they don't have a trusted healthcare provider. And so it's really helping to establish a good provider relationship, the parent with the provider, as well as the child or the youth with the provider. And so it's just something to be aware of, that this is something that children might already be experiencing or youth might already be experiencing, and then coming up with ways to combat this or help alleviate this stress that's already been caused. Next slide, please. So medical gaslighting, again, I think gaslighting has become a cultural phenomenon in terms of people being aware of what's happening just in terms of cultural or social settings, but it also can exist in medical settings. So medical gaslighting is the process of dismissing the physical or mental symptoms of a patient by a healthcare provider. So some examples might be telling the patient, it's all in your head, you're overreacting, oh, here we go again, or stop faking it, you're fine. I think myself included, I heard some of these phrases growing up. It's like, did you have a test today? Why are you faking it? What's going on? So instead of coming up with phrases and gaslighting a child, it's really understanding what is the underlying cause. And maybe they are experiencing physical symptoms or experiencing anxiety or other really real medical conditions. And so coming up to having an understanding with the child or the youth to move forward. So history of medical gaslighting can cause anxiety, fear, hesitation to talk to your doctor for treatment, hesitation to talk to your parents, talk to counselors, talk to medical staff, anything. And so it's really important to allow kids to have and experience their own symptoms and then working together to find a solution. Next slide, please. So some different phrases that we can work with, both for students and for staff. So encouraging kids to say, I'm not finished talking. Can you give me time to explain? I'm not overreacting or making this up. I feel really bad and need your help. So really asking for help and asking for what's needed. I know the test came back normal, but something is wrong and I still feel bad. Please help me. So these phrases that students can use will help trigger the adult or the medical provider in the process to take a step back, maybe really reflect on their own bias and then move forward to like help come up with a solution. And then some things that providers or staff or counselors can say is, I believe you that something is wrong. Let's try to figure it out. I want to help you figure this out. Can you describe what you're feeling? Try to come up with a new solution or try to come up with symptoms and a diagnosis even. Would it help if we identify the problem together? Let's narrow down how you're feeling. So maybe they just say, I feel bad. So really understanding what the symptoms might be and moving forward from there again. Next slide, please. So one thing that we just really want, I guess one phrase that we should really keep in mind is how we can empower students. So trust along with accountability, independence, participation, responsibility, and encouragement is really a great way to move forward with students and keep this in the back of our mind. Encouraging independence in the way that they can advocate for their own medical needs, for their own symptoms, participating in their own treatment plans, allowing them to come up with solutions, especially if they are feeling bad or you think that there's something else going on and you want to identify other underlying conditions, and then really putting the onus on the student and the responsibility to move forward, but the responsibility of the staff or the counselors or the providers to take charge and help those students, and then encourage them to take part again in their own treatment plan and to get better together. Use it as like a time to work towards improvement and encouraging them to come together. Next slide, please. Some three of the things that, again, to circle back to empowering the students, we really want to focus on education and awareness. So we can do this through trusting primary care physicians, peer-to-peer health education, attending guest lectures by healthcare professionals, health workshops and seminars, really encouraging students to learn about their own health and how they can advocate for their own needs. Education leads to awareness, awareness leads to advocacy, and advocacy leads to trust. And so this is just a really important kind of leeway or lead into them feeling empowered towards taking control of their own health. Accessibility. So if they're able to access campus counseling or healthcare on campus, this has been really successful in a lot of different programs. Margaret just presented on the dental program. So really just allowing access to on-campus health has really improved healthcare. It also has allowed students to kind of be proactive about their own health. Resources that are visible and available as well is super important. If they see a flyer and they can take it, if they see education, if they see like posters or health ed materials that are just up and accessible, it makes treatment options accessible. It just empowers students to, again, take control of their own health. And then connecting with tribal liaisons for appropriate referrals, especially for Native populations and kids that have different like alternative care methods or alternative medicine that is really in line with their own cultural needs is super important. And then the last, student engagement. So again, encouraging communication with guardians, parents, counselors at school, student health advisory councils, and then tribal liaisons. And then another important point is research projects on healthcare. This is really allowing the public health field to expand their ability to help people and expanding on what we know about youth health and being able to empower students to participate in some of these projects or some of this ongoing research. Next slide, please. So yeah, that's it. Again, I'm Betsy Kamara. If you want to reach out, my email and my phone number is on the slide. I'd be happy to talk through with you. We've done this presentation, a longer version at a couple different sites. So if anyone's interested in hearing more or the extended version of the presentation, I'll put you in contact with our health educator. But we're really promoting this type of work, and we have some education materials as well that I would be willing to share with you or Chris, and he can pass it along to the group. But thank you again, and I really appreciate the time to speaking about this today.
Thank you so much. So with that being said, does anyone have any questions for our epi folks, our oral health folks, or our folks in vaccine equity? And if so, you can put those in the chat. Seeing none. As always, you can contact us at our 520-724-7018 or our school support email for any additional assistance or any questions that you may not have been able to ask today. Definitely always give us a call or email us. But with that being said, that concludes our school health update call for October. Our next school health update will be in November, on November 6th at 1 p.m. So with that being said, I hope you all have a wonderful day, a great Wednesday, and we will see you back in November.